Around 2 million people in Germany are affected. Dementia comes on slowly and gradually, but incessantly. And that is exactly what we are afraid of. If we ask around among our friends and acquaintances, we often hear that one of their greatest fears is that they themselves will suffer from dementia in the later stages of their life, or that their spouse or parents will get dementia at some point. And since there are far more than the official 1.6 or 1.7 million individuals suffering from dementia in Germany, there is assumed to be a relatively high number of unreported cases. Each of us probably knows someone, you probably know someone, who has dementia. But how do I know whether someone I know already has dementia, or whether it is just age-related normal forgetfulness? Because it's a fact that as we get older, we become more and more forgetful. For many of us, the most important question is probably how to recognize this in others. And that's why I'm now going to tell you 5 very typical signs of dementia, and above all, how you can tell the difference between dementia and the forgetfulness of old age. Hello, my name is Dr. Tobias Weigel. With my YouTube channel, I would like to provide medically understandable and correct information about diseases, the causes, but also typical symptoms and signs of the diseases. And if you don't want to miss anything anymore, please subscribe to my channel now. It can be said that if we just get old enough, we will most likely become demented in some form. And that's exactly what these statistics are showing to us. Just under 20 or 21% of those aged between 85 and 90, and then even 40% of those who are over 90 years of age, a huge number, suffer from dementia. And many of us also have the symptoms or images of completely demented people in our minds. And that's exactly what we're afraid of. We want to avoid that at any cost. And that's probably why many people avoid going to the doctor to get checked, because they suspect they might have something, even if the first signs of failure and indications are noticed already. I will now name 5 typical signs of dementia, and I want to name 2 of them up front right away. Social withdrawal. I will explain this in more detail at the end of the video. And also anxiety. Yes, you heard that right. People who are suffering from dementia are often afraid or anxious. And there are various reasons for this. Fear can result from events from the past and present being mixed up, just to name one example. That is quite typical and occurs often. Others experience anxiety due to hallucinations or delusions. These experiences are also common symptoms associated with dementia, which I will address shortly. But fear can also be an expression of being overwhelmed by constant changes in their lives. So fear is a very typical sign of people that suffer from dementia. But at the same time, it is very important to recognize that nowadays we have the means to effectively decelerate the progression of dementia, allowing us to preserve a notably elevated level of cognitive function for an extended period ahead. You can do something against it. There's no cure for it to this day, but there are multiple ways to slow down its progression. An early detection is the most crucial part, and that should happen when those affected are actually still quite mentally fit themselves. Firstly, we need an early detection, and secondly, we need an early treatment. And that is only possible through education and, of course, by reducing shame of those affected. What is dementia? The term dementia includes several diseases that all include a decline in cognitive abilities due to the illness. That is the medical definition of dementia. You're probably familiar with Alzheimer's. Alzheimer's is the best-known disease of the dementia group. As I just said in the intro, more than 1.6 million people in Germany suffer from various forms of dementia. The number of unreported cases is high. So there are probably a lot more than 1.6 million. It's estimated to be around 2 million. Around 60% of all people with dementia have Alzheimer's, so 20% have a mix of Alzheimer's and some other form of dementia. And the number of unreported cases is, as I mentioned, very, very high. That is because many people are afraid of receiving the diagnosis. And signs of declining brain performance are preferred to be attributed to old age, and the visit to the doctor is then avoided at all costs. On the one hand, those affected naturally say to themselves, I'm not stupid. They don't want to believe it. And on the other hand, family members often think, I can't do this to them, when it comes to going to the doctor and saying that they've noticed their loved one is experiencing dementia. And that's why people avoid going to the doctor, even though it's so important. Dementia is primarily attributed to the gradual demise of nerve cells and the connections between them in our brain. As you might know, our brain is structured like a large network in which all the information we have access to is linked by a countless number of connections. It runs all over the place. These connections are particularly vital, and during the course of dementia, the brain can shrink by up to 20%, so a real significant reduction in size. If some connections, which are extremely important, are lost as a result, the information linked by these connections disappears. They are usually not entirely gone, but rather more challenging to access. This consequently makes remembering specific things a much more time-consuming process. I will now briefly mention the typical signs, as I mentioned earlier, but before that, I would like to touch on another point, namely the so-called risk factors for dementia. Because if you observe some symptoms or signs of dementia and simultaneously find that specific risk factors are relevant to either yourself or a family member under suspicion of dementia, the probability of this indeed being a dementia-related condition is much higher and should be investigated. And of course, those who are aware of the risk factors and take steps to avoid them whenever possible are in a much more favorable position to protect themselves from dementia-related diseases. That is the reason why knowing the risk factors is so essential. Risk factors for dementia? Science has now identified a number of relevant risk factors for dementia, which we should of course always keep in mind to be able to prevent it. That's why I emphasize this so much. The accelerated decline in mental and cognitive abilities is due to an unfavorable combination of unfortunate hereditary factors, but also certain environmental factors. So, what our brain is exposed to over the course of life, so to speak, and these are the risk factors, namely high blood pressure, high cholesterol levels, vascular calcification, and frequently fluctuating blood sugar. All these factors undeniably increase the risk of dementia, and this is well documented and proven. Inflammatory processes or frequent concussions of the head also increase the risk of dementia-related diseases, as this study and other studies with professional athletes in very tough sports, for example, have now shown. Some sports to mention are boxing, American football, including heading the ball in football. This is actually very good news for us because these are factors that can be influenced by us. This means that we have control over how high our risk of dementia-related diseases actually is. Dementia always begins slowly and gradually. And this is, as I mentioned before, one of the reasons why the typical signs are often only recognized very late. Sign number 1, memory lapses. And this is the characteristic sign that you are probably acquainted with and maybe have seen before, alterations in short-term memory, which have an impact on everyday life. And this form of forgetfulness can be seen in the following, for example. This serves as an example for you, that affected individuals forget important appointments, fail to remember to, for instance, turn off the stove, or can only organize their daily life after a certain period with the help of reminder notes, for instance. And this is one tip on what people can do if someone is suffering from dementia. Reminder notes. Something that's typical, however, as you get older and is not a disease, is that you sometimes get forgetful about names or appointments for a short time in the later stages of your life. But here is the significant difference, being able to recall those things later again. So if it's just age-related forgetfulness and not dementia, individuals often notice those lapses themselves. Or at the very least, when someone else brings the senior moment to their attention, they can acknowledge and understand it. Dementia sufferers, on the other hand, and that is the important difference to forgetfulness. People suffering from dementia very often cannot remember or notice the lapse. They might even agree with you in an attempt to conceal the lapse, not wanting to reveal that they've forgotten. But in truth, they may not be aware that they have forgotten something at all. Sign number 2, new language and writing difficulties. Many sick people find it difficult to follow a conversation and actively participate in a conversation. Another typical sign of dementia. Those affected lose the thread, use inappropriate filler words, for example, or have problems finding words. Frequent repetitions of stories can also be a sign. However, it is completely normal for people of higher ages to not find the right or best fitting word every once in a while. Sign number 3, spatial and temporal orientation problems. Often specific places or time intervals can no longer be classified correctly. Affected individuals may experience difficulties such as forgetting the current year or season, struggling to read a clock, or finding themselves disoriented on formerly familiar streets, unsure where they are, how they got there, or how to return to their home. Of course, this is already very advanced, and if this happens, this is clearly a dementia disease. On the other hand, as an example, it is completely normal and quite common that as you get older, you sometimes get the day of the week wrong. And this is crucial again, that they later notice their own mistakes and acknowledge that they were wrong. This is the same again as we discussed the memory gaps. If you notice the mistake yourself, then it's forgetfulness of old age, so to speak. At this point, it should also be said again that people with Alzheimer's and dementia, especially at the beginning, try practically everything so that those around them don't notice their lapses. That means that in this example, they might acknowledge it or act as if they did notice. Yes, I made a mistake. That was wrong, of course. In reality, however, they don't realize it whatsoever. And as you can imagine, among those affected, this will inevitably lead to frustration, inner anger, and dissatisfaction. And in addition to that, there are the aspects that I mentioned at the beginning, like anxiety and social withdrawal. Sign number 4, difficulties in concentrating and planning. This is another sign. Those affected by dementia find it difficult to concentrate for a longer period or to plan or implement something in advance. They need much more time for many things than they needed before the dementia started. Problems arise, for example, when cooking or baking, even if the recipes used to be very familiar. They have actually known the recipes for a long time but can no longer do it. Also when dealing with numbers, for example, when paying bills. However, normal, again as a comparison, it is normal to be distracted, for example, when there are so many things going on at the same time that you can no longer quite manage them. This is normal at a higher age. Sign number 5, personality and behavior changes. And this sign is usually the main trigger for relatives to take the affected person to the doctor to be checked for dementia-related diseases. For example, severe mood swings for no apparent reason. These can be the result of dementia-related disease. Also, for example, pronounced personality changes, that someone is completely different than before, that you wonder why they are suddenly so crazy. Extremely strong discomfort in unfamiliar rooms. For example, sudden distrust, aggressive behavior, or feelings of powerlessness, sadness, restlessness. I also said that as a person affected, you try to cover it up, so to speak, that you have dementia, that you can't remember certain things. As a comparison, the opposite is a normal age-related change. This might be the case if people react irritably to a change or interruption to regular everyday routines and get a little irritated as a result if they need a certain amount of constancy in their lives. That is normal. A distinction must therefore be made between age-related changes, which are normal, and changes due to dementia. What I'm about to say is very, very important. In the early stages of the disease, at the very beginning, those affected are at least partially aware of the decline in their cognitive performance. They notice, oh crap, I can't remember that, or I did something wrong and didn't even notice. Of course, as a result, they often feel insecure, depressed, or ashamed. The occurrence of defense mechanisms such as covering up or denying mistakes, using excuses, for example, withdrawing to avoid exposure, not wanting to meet other people because of this, not wanting to go out anymore, those things are of course understandable, but these are very, very important signs for you to recognize that dementia is probably present in this person. Again, another reason why you, as a relative, usually don't notice a dementia-related disease in the early stages and, as the person affected, understandably don't want to admit it. But again, especially at the beginning, it is important to go to the doctor early and start therapy. These early signs are similar regardless of the form of dementia and are all barely recognizable at first. This is the case regardless of whether you have Alzheimer's or another type of dementia. As I already mentioned, dementia develops very, very slowly. And there's another very important indication or a sign that I said at the very beginning. Many of those affected increasingly lose their initiative and motivation and pursue their hobbies, social or sporting activities less and less. They notice changes in themselves that make them feel insecure and consequently withdraw. This withdrawal is very typical and common. On the other hand, in comparison to just getting older, it is normal, so to speak, for people at an older age to feel stressed sometimes and more quickly than before, to be exhausted, to not have as much desire anymore. It's normal that the demands of work, family, and social obligations are becoming too much for you. So, the typical progression or course of dementia is the following. And you can check and compare if this kind of progression also applies to you or your relatives. At the very beginning, everything starts with occasional phases of inattention. Those affected repeatedly ask the same questions or struggle to find words in conversations, which is one of the signs I just mentioned. Another sign also is, for example, the well-known misplacing of objects such as car keys, wallets, documents. At first, this just seems like a sign of aging, especially because those affected often immediately say, oh yes, that's right, I remember. Very important again, they don't actually remember it, they wouldn't have noticed it themselves. Over time, deficits in more complex tasks become more and more apparent. For example, calculating change when shopping, reading a bus schedule, or filling out a form, all these things are becoming increasingly difficult. At the same time, some people's behavior is changing, and this is very important. People who normally react very calmly, for example, suddenly become quick-tempered, irritable, frustrated, and argumentative. Familiar people are suddenly viewed with a level of suspicion. That is another very typical behavior. They suddenly start saying things like, oh no, I don't want to see that person. So they become increasingly distrustful. And this often leads to affected people staring to avoid contact with friends or family, for example. The suspicion of dementia then tends to come from the environment. It is not the affected person themselves who goes to the doctor, but their environment, their relatives take them, and they often see and notice the behavioral changes much more clearly than the person affected themselves. As I said, it is crucial for you as a friend or relative to recognize these signs of the disease as early as possible and then take the person affected to the doctor. As is so often the case, the same applies to dementia-related diseases. The later medical treatment is received, the less opportunity there is to influence it, unfortunately. You are welcome to write your experiences directly below the video in the comments. Let's have a discussion about this topic, a topic that contains a lot of shame. Thank you very much and stay with me.